being a rural community, I think they feel we don't have a good grasp on living a good life. I mean, I really do. Kind of look down on us being rural.
I live in this community, which has approximately 250 people. We have a lot of low-income people, a lot of poverty line people, and the problem here is if you don't have a car, you can't get out.
The biggest problem with transportation is that we have to use it Monday through Friday. They cut off the service in Brawley on Saturday, so I couldn't go locally. I wanted to go to church, so I had to get into IVTXs and go to church on Sunday in El Centro. That's 50 miles away. But I did it because that's the person I need to be. So in essence, after hours, I want to do something. I like to go out and I'll go dancing or go to a nightclub or something, but those services are non-existent.
It takes approximately a little over a half hour from Pleasant Hill for me to go to my dialysis, and about the same amount of time for me to go for my kidney treatment. 2.5 hours one way, and 2.5 hours, 5 hours a day, that kind of thing. And I got to be at the dialysis 4 hours just for the treatment. So basically, my whole day depends on this, either going to the doctor, coming back from the doctor, or being at the doctor. So it's not much that I have as far as free time.
Either one of us want to move into the city until we know it's going to eventually come to that, because we've seen that with a couple of other neighbors. There was one couple that had the farm south of us. He was born and raised there, and he didn't want to leave the farm, but he knew with their health and accessibility to help that they had to sell the homestead and moved into assisted living. And, I imagine we're probably looking at the same trajectory for ourselves, but who knows?
Una persona que me mandó para San Diego. Vea, ya aquí no te van a hacer nada. Aquí en el valle no te van a hacer nada.
Where we live in that little elderly community, we all look after each other.
How do people look out for each other in your little community?
We know each other's health problems, and we know if one of us needs something or gets down or needs help with something. And if you aren't on your schedule, somebody will notice you're not on your schedule, and they'll call and say, "What's going on?"
Good morning and afternoon to many of you. Thank you so much for joining us for today's webinar entitled Policies That Work, a Blueprint for Improving Aging in Rural Communities. And I want to say thank you to the SCAN Foundation and the Public Policy Lab for that wonderful video, and to all of those contributors who shared their lived experience. We're really excited to be together today to talk more in depth about the importance of bringing age-friendly care, multi-sector plans on aging into the rural areas, but from the perspective of asking the rural areas what is most meaningful to them. And then on behalf of the co-hosts for this event, I would like to say thank you to the California Collaborative for Long-Term Care Services and Supports, UC Davis's Betty Irene Moore School of Nursing, the SCAN Foundation, and then I'm very glad that my organization, the National Rural Health Association, is able to be a part of this. I'm Laura Hudson. I have the opportunity to work with the National Rural Health Association, where, for those of you unfamiliar with us, our goal, our mission, everything that we do every day is to provide leadership on rural health issues. And so while we are a national organization, we know that there's so much to learn from the community level from across the country. As you can see from the next slide, to tell you a little bit more about who we are. We're a nonprofit, nonpartisan membership organization, again, representing the 62 million people plus that call rural America their home. And we do that through advocacy, communication, education, and research. So when given the opportunity to talk about multi-sector plans on aging in a rural context and making sure that they're represented in the state level conversations, it was just a perfect connection. And then the next slide shows how are we connected to this work. Well, you can see where we are across the country, where many of you are. I've heard that there are 36 states represented in this call. So you can see where our members are. And then for those of you that may not be familiar with NRHA, you may already be working with your state rural health association, and you'll hear from two great state rural health association leaders a little bit later in this time together. But our connection to this is obviously that there are older adults in every part of the country, but especially in rural America, we are very cognizant of wanting to make sure that they have the supports that they need to live. And again, the shared experience, we've heard that over time again. So in January of 2023, we began the opportunity with the Johnny Hartford Foundation to partner around older adult opportunities in rural America and finding ways to lead, partner, and follow. And for the benefit of this group, one of those major contexts is working with community health workers or similar health professionals to bring older adult care into the communities around there. So I'll put our link into the chat. But again, we're really excited to hear more about the opportunities that have been supported by the SCAN Foundation and the UC Davis School and the leaders on this of going to rural communities and connecting and asking them what works best for them. And then seeing how what worked in California in different areas can be broadcast across the country into many different areas. So with that, I will turn to the expert in this field, someone that I greatly respect and learn from every time I have the opportunity to hear her present. And that's Dr. Pauline Delane Martinez. So Pauline, I'll turn it over to you.
Thank you so much, Laura. And I think I'll be sharing my slides here. Should we transition, Nancy?
Sounds good, Pauline.
Great. Well, yeah, I'm always so inspired to learn about the work of the Johnny Hartford Foundation and the National Rural Health Association. And it's really an honor to share about our work here in California with you all. As Laura shared, I'm Pauline DeLang Martinez, and I lead program and policy research at the UC Davis School of Nursing Family Caregiving Institute. And it's really a privilege to join you all today to share about a new toolkit that our team developed with support from the SCAN Foundation to guide rural leaders in developing multi-sector plans for aging. So today I'll start off by providing some context of how the toolkit came about, and then I'll introduce the toolkit itself. So to begin, in January 2021, California launched its first ever multi-sector plan for aging, known as the Master Plan for Aging, a 10-year blueprint for promoting healthy aging and supporting quality of life. The Master Plan for Aging outlined 5 bold goals listed here on the right to improve housing, health, equity and inclusion, caregiver support, and affordability. The state plan brought together diverse agencies, cabinets, and departments and engaged statewide service providers, academic research partners, and philanthropic organizations to develop a comprehensive plan with specific deliverables and timelines. This has sparked a national movement, with many other states also working to develop their own multi-sector plans for aging. As you can see on the slide here, the 8 states in red have developed or are currently implementing a multi-sector plan for aging. The 8 states in royal blue have a legislative or executive order to develop an MPA, and 22 states shown in light blue are fostering development. A multi-sector plan for aging is a comprehensive strategy that drives cross-sector collaboration to address gaps in infrastructure, increase access to resources, and build out assets such as healthcare, transportation, housing, care coordination, and support services. When California launched its MPA, there was a recognition that to truly implement change, MPAs should be developed at all levels of government, including at the county and regional levels. The California Department of Aging launched a local playbook to guide these local planning efforts. And right away, many of the more affluent and urban parts of the state launched into their MPAs. And some, in fact, had already been doing this type of planning for many years. However, our rural regions did not have the resources or the bandwidth to embark on this type of effort. At the same time, we know that rural communities can particularly benefit the most from a multi-sector plan for aging. Research shows that rural communities are more likely to experience a higher proportion of older adults, a higher prevalence of disabilities, greater levels of financial insecurity, the exponential impact of geographic with racial and ethnic disparities, barriers to healthcare and behavioral health services, lower access to long-term services and supports, which leads to a greater reliance on informal caregivers. There are massive transportation challenges, a digital divide, greater vulnerabilities to severe weather and climate-related disasters, and overall, we see a lack of representation or attention to rural needs among statewide coalitions that are focused on health or policy making. And while many age-friendly models exist in urban and suburban areas, they don't translate well to rural settings. All of this makes local cross-sector engagement even more critical to tailor practices, policies, and programs to the community. Recognizing this, in January of 2022, the SCAN Foundation invested in 3 regional coalitions to develop local MPAs covering rural regions. The first, the Diversibility Advocacy Network, focused on Shasta, Butte, and Glenn counties located in Northern California. The Central Valley Long-Term Services and Supports Coalition focused on Kings and Tulare counties located in the Central Valley. And the Inland Coalition on Aging focused on San Bernardino and Riverside counties, which is also known as the Inland Empire. Each of these regions has unique geographies and challenges. The North State area includes vast rural and frontier regions. Within the last 5 years, this region has been particularly decimated by wildfires and extreme winter storms. These natural disasters exacerbated already existing shortages in housing and the healthcare workforce. Our second region, covering Kings and Tulare counties, is highly agricultural, producing 1/4 of the United States fruits and nuts, and Tulare County is the largest dairy producer in the nation. While these counties are younger on average than much of the rest of the state of California, this is because residents have some of the worst health outcomes and shortest life expectancy. In this region, 40% of older adults are Latino, and older adults are more likely to be living in multi-generational households. Our third region, the Inland Empire, covers a vast geographic territory. 3/4 of this region is undeveloped, and older adults who live in remote desert areas need to drive up to 3.5 hours each way to reach county services and medical care. The Inland Empire has the fastest growing population of any region in California. Between 2010 and 2060, it is projected that the prevalence of adults aged 85 and older will grow up to 700%. The Inland Empire is home to 13 Native American nations, and Riverside County has the largest LGBTQIA+ population in the US. So as you can see, the 3 regions represented diverse geographies, climates, and demographics. Throughout our 2-year initiative, the 3 regions formed advisory committees, conducted community needs assessments, and engaged diverse community members to develop a set of locally informed recommendations for new and expanded policies, practices, and programs. We're extremely proud of the 3 local plans that were developed through this initial pilot program, and you can access them on the links shown on the slide here. I was honored to serve as the lead consultant on the project, which allowed me to serve as a communication bridge across the 3 regions. We met together quarterly to discuss our shared process and to share lessons learned, project templates, and tools. Drawing upon all of the work from these 3 regions with the support of the SCAN Foundation, in 2024, we developed a toolkit for rural leaders and organizations who seek to engage in robust, community-wide age and disability-friendly planning. While this toolkit was based on our experience here in California, The principles, tools, and lessons are applicable to rural leaders across the U.S. The toolkit is organized into 10 steps to develop a local MPA. Throughout each of the steps, we share case studies, templates, and tools that can be adapted to your community. And there's also an appendix with national resources related to each step. Altogether, the toolkit offers over 125 templates and links in an organized and easy to use format. The toolkit covers the 10 steps listed here. First is identifying leadership and staffing, and this section also highlights some potential funding sources. Step 2 is forming a multi-sector advisory committee. Next is building public awareness and support through engaging elected officials and multimedia outreach. Step 4 is conducting a landscape analysis of local data and aging services. And then facilitating inclusive community engagement through surveys, focus groups, listening sessions, or town halls, with an emphasis on engaging underserved communities that typically have not had a voice in community planning. Step 6 is to synthesize the findings and narrow down recommendations. In step 7, we encourage an iterative process of gathering feedback and additional community input to solidify your MPA goals. And then the toolkit describes how to build out an actionable implementation plan, evaluate progress over time, and importantly, ensure accountability and sustainability. Throughout our initiative, we partnered closely with the California Department of Aging, and we were thrilled when they announced a new grant program in 2023 to support local aging and disability action planning efforts in 21 regions across the state. The Northern California and Inland Empire regions each received additional funding to continue their planning efforts through June of 2025, while the Central Valley region dove straight into implementation. Just last month, our team at UC Davis was thrilled to receive a new grant from the SCAN Foundation to continue collaborating with all 3 of the rural MPA regions to develop a series of state policy briefs focused on housing, healthcare, and long-term services and supports. The most recent policy brief focused on rural aging in California was published back in 2011. So we couldn't be more grateful for this opportunity to support a collaborative rural advocacy effort to inform legislators of the unique needs and opportunities to better support older adults and their families in rural areas. So with that, I will pass it back to Maria, who's going to introduce leaders from 2 of the rural MPA regions, the North State area and the Inland Empire. So thanks so much, Maria.
Thank you so much, Pauline. My name is Maria Kalina. I'm the Executive Director of the California Collaborative for Long-Term Services and Supports. And we are a statewide coalition that's incredibly invested in seeing California's multi-sector plan for aging being implemented and really taking root across the many diverse communities in our state where the needs and resources may look very different. I think oftentimes when people think of California, they think of Los Angeles and San Francisco, but the reality is that a lot of California's makeup is rural communities that encompass diverse landscapes from coastal towns to agricultural valleys and mountain regions. These places are home to unique cultures, traditions, histories that enrich the state's identity and serve as the backbone of California's economy. And I am so honored to be here today to introduce 2 of our coalition partners to share a bit about their experiences developing local multi-sector plans to address the needs of a growing older adult population. First, I'd like to welcome Carmen Estrada. Carmen is joining us from Southern California, where she is the Executive Director of the Inland Caregiver Resource Center and co-chairs the Inland Master Plan for Aging Advisory Committee. And I'm going to ask Carmen if she could please share a bit about where the Inland Empire is in the process of developing their multi-sector plan, and what has that experience been like for you and your partners in the Inland Empire?
All right. Thanks, Maria, for the introduction. And also thanks to, CCLTSS, the SCAN Foundation, California Department of Aging, UC Davis, everybody who's been involved in helping support our efforts. Like Pauline mentioned, the Inland Empire is comprised of Riverside and San Bernardino counties. And it covers more than 27,000 square miles and has a population of 4.6 million people. We have mountains, we have lakes, we have deserts, various different types of deserts in our region. And just to give you a picture of how large the region is, we are actually larger than 10 of the US states in the nation. San Bernardino County alone is the largest county in the US. The IE is predominantly Latino, 51%, 51.6% is Latino, followed by African American, Asian American. 20% of our population are immigrants. So definitely a lot of diversity in our region, and also covering a very huge region. Pauline, were you going to share the slides? Oh, there you go. Okay, next slide. And so how did we, figure or why did we want to create a local master plan? And Pauline mentioned this. We are facing a common concern in both counties, and that is that the projected growth rate is going to be 682% of individuals 65 plus by 2060, something very alarming. And so this common concern really is what led the region to work together, because it's two very different counties, to work together to make services better for caregivers, older adults, and adults with disabilities in our region. And so spearheading this effort is the Inland Coalition on Aging, which is comprised of individuals that are serving both communities and are serving the populations that we're focusing on. And so really we focused on the common concern, equal representation between both counties in our process, awareness, a lot of collaboration, which continued engagement, and again, all to reach the common goal of making things better, aging better in the Inland Empire. Next slide, please. And so to give you a little roadmap, as we like to call it in the Inland Empire, our roadmap to aging well of our process. Our process began in August through a virtual convening where we discussed the state master plan, and we really thought about, is the state master plan reflecting the needs of the Inland Empire? In some ways it was, and in some ways it wasn't. For example, one of the main things that the state plan does not include is transportation. Our 27,000 square miles, transportation is extremely important. So through that convening, we decided that it was important to create a plan locally that would address our common needs and concerns in the Inland Empire. And so after that, we put together an advisory committee. Again, equal representation between both counties was crucial from the beginning. We would not be able to do what we have done if both counties are not working together. As well as awareness. We wanted to make sure that the community was informed of this process so they can participate in the process and so that we can gather feedback. And so on this slide, which I believe we will share, you have links to our website and to the preliminary report that we created that you're welcome to take a look at. Next slide, please. All of our findings and recommendations, which we came up with a total of 76 findings and recommendations through our process, they all highlighted the need for better collaboration amongst providers, greater awareness of services already in place, because we found that the IE, we're rich in resources, social services, but that the community was not getting connected with those resources. It also highlighted the importance of education when it comes to advocacy, caregiving, Alzheimer's, and other dementias, and the importance of taking into consideration quality of life when it comes to aging and planning for aging. So to narrow down these 76 recommendations, next slide, please. We formed work groups, and the work groups met since February of 2024 to August, we've been working to narrow down the recommendations and create goals, strategies, and actions to help us implement the plan. Again, with continued engagement and collaboration with our partners, and also a lot of awareness. And so to be able to do this, we have monthly meetings through our Alien Coalition on Aging, where we are able to share with professionals different ways they can enhance the services that they provide, as well as a monthly streaming on YouTube where we can disclose to the community our process, where are we at in creating this master plan. Our goal is to complete this plan by June of 2025. So we're almost there. But like I mentioned before, it really has been important for there to be that common concern, the common goal, and organizations that are vested in working together to reach those goals and to really work together to better the lives of caregivers, adults with disability, as well as older adults. You're welcome, on the slide you have links so that you can get connected if you want to see some of the different things that we are putting together, as well as updates on our plan. And so it definitely has been a difficult task. I wish we had this rule toolkit that you all have now at the beginning, but I'm also excited that we've been able to participate in creating this toolkit for others in hopes that it is replicated. Because if the IE could do it with such a large geographical area, then really anyone can do it and work together. And it starts again with having that common concern in the community. Thank you. You're muted, Mariah.
Faux Thank you so much, Carmen. I appreciate that quick overview. I know we don't have a lot of time. Carmen, you mentioned having links in the PowerPoint. We'll definitely be sharing those out with everybody so you can access some extended reading. So next we'll hear from Carolyn Nava, who's joining us from Northern California, where she serves as the Community Relations Director of the Disability Action Center. And she also chairs the Diversibility Advocacy Network. Carolyn, I'm wondering if you can share where our partners in the North are on the development of their multi-sector plan for aging, and how has your experience with this process differed from Carmen's in Southern California?
Thank you, Maria. Thank you, everyone, for having us here today. We actually, with support from the SCAN Foundation, the Disability Action Center was able to found the Diversibility Advocacy Network. It's been more than a decade now. So for us, these causes have been active in our spirit for quite some time, and we were excited for this multi-sector plan for aging initiative, especially looking at how it's now grown to a nationwide effort. Our current geographic engagement covers more than 9,800 square land miles. There's a lot of water up here as well, but the land miles is comparable in size to perhaps the state, I think, of New Hampshire or Vermont, that we're actively working in. And that represents about 50% of our coverage area. So I would say we're getting there. Our goal is to have everyone included in this effort in our 9 rural counties that we do service. Some of those counties are pure frontier land, and by that we mean maybe you have 6 to 8 individuals per square mile. So concerns like transportation, concerns like social isolation, and it was mentioned earlier with Dr. Martinez, the housing situation and the IHSS care provision in the wake of disasters, multiple disasters. Some of you may have heard through the national news network about the Park Fire, which burned more than 1 million acres of our rural territory and natural forest land. That fire, the 0 point for that fire was less than 2 miles from our Dan Center location. So that's what we mean about, disasters. It's been constant. We are also less than 10 miles from the historical Paradise Fire that happened about 6 years ago. So it's been a constant barrage of activity. But I think what's really prominently different, and We talked about this, Maria, in preparation, and that is the conservative environment that we are surrounded with. And because of that conservative environment, a lot of the social service issues just don't take front seat at conversation tables. But in our activities, rather than using our group energy, you can see our counties here. 4 counties have come together with education, and we're building local leadership to advance our rural master plan for aging. And our spirit is bringing what we call like-hearted service leaders together. Next slide, please. And in doing that, and focusing on what's more like-hearted in such challenging terrain, we already know that it's difficult to bring people together and make important decisions and all be on the same page. So our goal is to focus on the commonalities. We thought to ourselves, well, how do we do this? Because not surprisingly, we all have pretty much the same interests when we start talking to each other, and that's having healthy families and children and making sure that our aged loved ones and those in our community have the care that they require and that they're close to the people that they know and love. Adequate and affordable housing, social activity for all ages and stages, and being active in advocacy for the disability community, how that plays in as we are getting older and living in place, if that's what we choose to do. And so an analogy that came into our consciousness, if anyone's musical out there, you can relate to this, the thought of musical counterpoint. Think about the song by the Beach Boys, Good Vibrations, how you have these 2 musical tones going, but everybody loves the song, right? So what we decided to do was to look at all of our voices and think, yeah, we've got voices that appear to be notes against notes, just like counterpoint music, so to speak. But we also recognize that those independent voices and concerns have a common harmonic independence upon each other. And so when we look at having that common melody throughout our large region, we think about the fact that we have a California Master Plan for Aging Initiative and those 5 bold goals that are set for 2030. So when we stick to that, that becomes our common melody. And so we all strive to maintain, when we come together, this atmosphere of acceptance and inclusion, no matter what our personal philosophies are. So we always welcome everyone to our solution finding discussion table. And as a result, our activities, our major events are showing growth. And we regularly draw in a variety of points and perspectives that we believe are valuable to continue on and build this final regional masterpiece. We are looking at building a template that all cities, all counties in our rural region will be able to take that template and hold that spirit together with the common situations and circumstances that we know are unique to this rural frontier region. And also, next slide, please, just in wrapping up, allowing that grace in the process of working together. We are now solidly more than 5 years old and looking at development markers that help us grow. You know, you think about a human child, a 5-year-old child, they should be playing with others. They should be conversing back and forth in 4 or 5 sentences in conversation and doing simple tasks around the home. We are at that stage. We're talking to each other. We're working with each other. We have work groups. We have an advisory committee comprised of leadership from 8 different counties, 4 of which are assigned to work with the Department of Aging and are our chairs for our advisory committee. So we feel like we're just getting started, but yet we welcome anyone to contact us because there's a lot more to share that we just can't get into this small space that we feel might help all of you get a little bit further in your goal.
Thank you so much, Carolyn. A lot of fantastic work happening in Southern California and Northern California, and we know it's happening in our Central Valley as well. And I'm seeing in the chat questions about where the master plan for aging or the multi-sector plans for aging are taking root in communities, questions about what is happening across counties. And I just want to point out that the California Data Master Plan for Aging data dashboard has a map. And we'll share that out along with the post webinar materials. Make sure you have that. Now it's my pleasure to introduce Andy Lowe and Anne Marie Day from the New England Rural Health Association. And I'll just say, in our prep calls, it was really striking to learn how similar the challenges are from communities on the West Coast to the East Coast. And so I'm wondering, Andy and Marie, do you have any reflections on what you've heard thus far and ideas about how the toolkit and the California experience applies in other regions?
Yeah, I think for me as well, it was surprising just the applicability. We think of rural communities and they can be really diverse, whether it's, as you mentioned, a desert community, or in New England, an isolated island community, or up in northern Maine, very frontier near the Canadian border with small populations. And so I just think giving a toolkit and some structure and foundation to rural communities where there may be limited resources to build out some of these plans is wonderful. A few facts of New England: we're some of the oldest states by median age, and although we are small geographically, as you mentioned, some of your California territories are as big as some of our states. We are primarily older and rural. And so I just think this was a really wonderful toolkit and lots of consideration into the rural disparities that really are relevant no matter the region. Andy?
Yeah, absolutely. A lot of these themes totally resonate for us, and I think resonate around the country. There's absolutely no question. Laura sees this stuff all the time. We deal with State Rural Health Association leaders from around the country, and nothing that we're hearing is raising any flags as being significantly different from what the issues are that you're dealing with. Transportation, housing, nutrition, all those things are clearly what people are experiencing. And environmental and climate change are also adding everywhere. In New England, we've been seeing historical flooding in recent years, northern New England, and the connection between public health and climate change and environmental issues is becoming clearer and clearer. And our aging populations are particularly affected. So there's absolutely no question that what is going on here, it makes broad sense. And what I find to be really compelling here is the development of a toolkit that other states can use. So that's great to hear. I was glad to see that Vermont and Massachusetts have already embarked on their MPA. I actually wasn't aware of that, which is great. But once again, I agree with the same situation that's been described, that our rural communities are certainly lagging behind our urban and suburban communities. So while, in some of our eastern states, east of the Mississippi, they may be smaller and they may be drops in the bucket compared to some of these large counties, the issues remain the same largely. And so all the applause in the world for developing the cool toolkit and for your efforts on the ground. The need for collaboration and partnership remains the same. It remains the key throughout.
Thank you so much, Andy. Thank you so much, Anne. And now I think we are going to turn to Q&A. Is that right, Nancy? We can go to the next slide. Thank you. It's my pleasure to introduce Callie Peterson, who's the program officer at the SCAN Foundation. And as you've all heard, the SCAN Foundation really supported these 3 regions in California in getting started in their planning process for the multi-sector plans for aging. And Callie is going to lead our Q&A discussion. So I'd love to welcome her to the stage.
Good morning, good afternoon, everybody. I am just thrilled by this discussion thus far and want to thank all of our presenters for sharing and elevating their experience in regions within California and beyond. And we have been thrilled to develop this toolkit in partnership with UC Davis, as well as the California Department of Aging, which I know is participating. Jackie put in some great links in the comments to look at data on other counties that are not currently being featured in this webinar. And we're very proud of this work. And we hope that all of you who are participating today can see yourselves in it and can hopefully apply it to your local communities. I've seen a number of questions in the chat. I want to tee up a couple if Laura and Pauline are still on. There was a question about how do we define rural? And just to tee up for Carolyn and Carmen to think about, there was a question about how do you help your local community members talk to government officials about the work that you're doing when your community members are not used to talking to government officials. And while you're preparing those answers, I did want to introduce and invite a wonderful colleague of the SCAN Foundation's, Amanda Lawrence, who did serve as the project director for California's multi-sector master plan for aging, really from its inception. And in fact, when we had this original idea to create this toolkit, I called Amanda and said, how do we bring this to fruition and help more regions across our country? Amanda is currently a consultant and working with organizations like UC Davis and the SCAN Foundation, as well as government entities focused on age-related strategic planning, including development of local aging and disability multi-sector plans. So Amanda, I think an important theme that was touched on by our reactor panel, which is, of course, we created this toolkit using examples from California, but our hope is that people see themselves in it beyond our borders. And could you speak to from your experience about how you think folks in other states can use this toolkit?
Sure. Thanks, Callie. This tool, I think, is highly applicable to all local and statewide planning. Even the smallest of states have rural regions that must consider aging and disability planning to meet the unique landscape that exists in the rural regions. The guide can be helpful in illuminating how you can really ensure that rural considerations are taken into account when you're doing your statewide planning. So there's lots of little nuggets in this toolkit that you can gain insights from. It's just been really well laid out by Pauline and team. And additionally, each state really has to consider how many aspects of their multi-sector plan for aging is going to be supported and implemented on the ground through local partnership and through service providers. And through the highlighted case studies and resources in this toolkit, it'll guide the users to support their understanding of the challenges that rural communities face and those assets that can be tapped on the ground. And ultimately, the steps will highlight throughout this process, the developmental steps are really universal to statewide and community level multi-sector plan for aging and disability. So building partnerships, conducting outreach, collecting community and stakeholder input, and conducting community landscapes, developing advisory bodies, and identifying data sets that are going to be useful for planning and evaluation. That's all in this toolkit, and anybody can make use of that. You're just going to need to make a few adjustments. Obviously, and they'll be obvious to you, like you're not going to gather the board of supervisors and the mayor. You're going to talk to your statewide executive leadership. You're going to work with stakeholders and advocates to have a wide reach. So you want to include people who are influential on the state, but also locally. And then there's just so many resources in this toolkit. We have at the end of the toolkit 7 pages of links to really key aging, health, and strategic planning resources that you can find useful. I also want to say that one of the most common questions I hear from folks who are embarking upon multi-sector plans for aging is, are there any templates available? This toolkit has templates and sample documents linked throughout the entirety. So no need to, start from scratch. There's plenty of resources in here for you. You can just adapt them to meet your needs. So overall, the toolkit really will be useful for anybody. And one of the things we heard a lot in California, as you heard from our guests, is maybe they didn't see rural in our state level plan enough. This is going to help guide your thought process to make sure that you are considering those needs around state level, around local aging and disability resources, partnerships, needs, assets, etc.
Thank you, Amanda. That's really helpful. And while this hasn't been explicitly stated in the chat that from questions from our audience, I know that it's likely right under the surface, which is how do you do all of this if you don't have a funder that's come in and given you a grant to do this work, or the state supporting you financially, or how do you do this with limited funding? Maybe we can bring in a couple of our other speakers, Carmen, Carolyn, but Amanda, maybe you can kick us off in ideas that you have for our viewers on that front.
Sure, yes. Creativity is key. I do want to draw everyone's attention, though, that step 10 in the toolkit is ensuring accountability and sustainability. And so in there, you'll find some ideas for how to access grant funding. And we do have in that compendium of resources a couple links to folks who fund specifically rural or aging projects and planning. But don't discount more broader philanthropic organizations, because we really do need to work to make sure that everyone is seeing aging and disability as having a place in their funding portfolio. And we did have at least one county in California who used local tax revenue to build out their plan. So they were able to pass a tax that would fund their MPA efforts. But as my local directors for their local MPAs will tell you in a second, it's a lot of work, and the development phase is very intense. It is basically you need someone fully funded full time to really ensure that you are doing all the stakeholder engagement and just collecting and analyzing data and information and input. So that is where you're really going to need to find some significant funding, and then be creative through implementation related to grant funding, state funding, local funding, as well as what you can do through partnership. How can you actually utilize each other and leverage each other's assets as you implement the plan? But I'll pass it over to the two local representatives to answer and to share their experiences.
Carolyn?
Thank you so much, Callie. Hi, Amanda. You know what? These are really tough but important questions. And one thing that I can say is we don't do this alone. As chairs of coalitions, as community members, advocates, it's all, I looked at the participants today and I see so many that we've been working with over the years. You look down the list, there's Catherine, there's Corey, there's Jessica, there's Joanne, all of these people that have been working fervently. Our AAAs are here, Mary and Terry, and some of our social services leaders, Tiffany, some of our local government representatives have shown up here today. But that came with time and consistent effort to really get personal. We don't just talk about the business when we come together. We're talking about, hey, what was your son's baseball game, last weekend? How'd it go? This is about relationship building. And you must start somewhere. And when it comes to building relationships, what you're going to find is many of these individuals have a vested interest in doing more in their community. I think about Catherine. Catherine has this amazing voice to reach out, not just to the community. And Tiffany and Joanne, they regularly show up at council meetings and whatnot. So it's finding out who in your community is already interested in just helping them to get more involved. I could not do this without the people that have been showing up at the table. Many of those people, some of them were a little shy at first, but I just said, hey, let's have a cup of tea. What do you want to see out of this? Why are you showing up now? And in doing that, this broader relationship developed, which empowered them to do even more in areas that they were already interested in.
Thank you so much, Carolyn. So almost kind of building off other investments and kind of connecting it to your MPA efforts. Carmen, do you have anything to add on the resource front?
Yeah, definitely to add on to what Carolyn mentioned, it takes time, and we have this great tool here that is designed to guide you, but you also have to make it personal to the community that you're serving. And so it's important to kind of take inventory of what the needs in your community are. They may be different from, like our community in an empire. But it's a process, everything that we learned over a period of, we've been working on this almost for 3 years now. We didn't have all the answers at the beginning, but what we did have is a common concern, right? We were concerned about aging in the Inland Empire. And so we came together, and we brought organizations that had that vested interest. I work for Inland Caregiver Resource Center. Our mission is to help communities and families with challenges when they face caregiving and aging. So that's perfect for a master plan for aging. And we're not the only organization with a similar mission. It's so finding those organizations that have the similar missions, that are concerned, and that are already doing some of the work, to just start discussions about that. And I know there was a question about reaching the government too. That's something that we was challenging for us. We're working with 2 counties, 2 boards of supervisors. How do you engage them? That is also a process, because each region may have different processes to follow to even get in contact with them. So it's really being patient, and giving yourself grace as you're learning in this process. But you just know and have faith that if you have that common goal and that common concern, that is so valuable, making the lives better for older adults, caregivers, adults with disabilities. That's really the key, having that common goal and that common concern.
Wonderful. And Carolyn, I'm thinking back to something that you said in an earlier discussion on this resource front, which was to also think beyond your area agencies on aging, and also to partner with your centers for independent living, as well as looking at your aging and disability resource centers, as well as local universities. UC Davis is here participating in this project. So just thinking on a much more expansive scale on the resource front. I do want to share, which I shared at a recent Grant Makers and Aging forum, that the SCAN Foundation roughly invested $50,000 into each of these communities. And so I share that because you might be able to talk to local funders that support your region. This isn't a multi-million-dollar investment from the SCAN Foundation. It was a modest investment. And certainly Carolyn and Carmen, who have offered their details, can share how they applied those funds to really kick off this process. In addition to bringing someone like Pauline on board, and you cannot replicate Pauline or Amanda, but hopefully the toolkit does put you into the right direction of all the wonderful work that they organized for these 3 regions. I did want to circle back to that question of how do you define rural? I think that has come up a couple of times. Carolyn, Carmen, Amanda, is that something you can speak to? Pauline, you're welcome to be brought in, as well as Laura. I think this is something that actually comes up quite often, and just want to be able to address it. I see that Amanda, you're still off mute, but I also would invite Laura and Pauline to speak to this question.
So I will quickly say that unfortunately there is not a standard definition of rural, or maybe that is fortunately. Many state and federal agencies have their own definitions. And so from the national perspective, at NRHA, if you can consider yourself rural, so do we. But when it comes to any activity, especially with qualifying for different things, I normally look to the lead organization or the funder and the definition that they're using. But I put it in the Q&A section, but I'm going to add it to the chat. The Rural Health Information Hub actually has a tool that says, "Am I rural?" So I'm going to place that in there, but I'm going to turn it over to Pauline for some more maybe California specific information.
Yeah, that's great, Laura. That's a really, really great tool. I think one of the problems, like Laura said, is there is no one definition. And in some cases, it's defined at the county level, and other cases at the census tract level. In California, we have massive counties. As Carmen shared, San Bernardino is the largest county in the US. And that's quite different. If you look at the East Coast, they have really small counties. And so using the county as the defining factor is just not really useful for us in California. Unfortunately, like, the region that Carmen's working in, take Riverside or San Bernardino, they might have one tiny little urban corner, but the rest of the county is primarily rural. And so if you look on average across the county, they might appear to be urban or suburban, but in reality, there's so many residents that are living in really rural areas and could benefit from these rural resources.
Wonderful. While I have you all here, I see a number of questions that are coming through. Stephen Woodward is asking a question specific to type 1 diabetes. And I'm wondering, Laura, are there specific resources available from a national perspective? Pauline, were there any kind of specific notations around type 1 diabetes within, and or Amanda, on the state MPA? Carolyn and Carmen, is this something that came up in your discussions locally? I want to be responsive to Stephen's question, given many people are facing this.
I'll jump in, Callie. That's definitely something that's been addressed in our area. And there are, Stephen, you're in California, and there are specific groups that are looking at that and catering to that. And I can find that out, a little bit more information about what we've turned to in our local region, because that's something that came up fairly recently. And I will add, the information was coming through the local Center for Independent Living. So if you are not connected with the Independent Living Network, Stephen, you can contact me. I can let you know what the closest center is to you. There are, I believe, 28 in California, so one of them is bound to be closer to you. And that's the kind of information that they live and exist for distributing. So type 1 diabetes, any type of diabetes is not good, but type 1 is especially severe. And I encourage you to either reach out to me, we'll help you get connected, and we'll also help you get connected with that local Center for Independent Living, which will stay with that as an advocacy effort to make sure that you get what you require.
Thank you, Carolyn. I think this also speaks to the network of this effort. Carolyn and Carmen are part of a regional coalition, as well as our Central Valley partners, and building that trust among partnerships is, I describe it as gold. You can't replace it. It just creates such an opportunity for connections to access and resources. So Carolyn, thank you for speaking to that. We have just about 2 minutes left, and there's 2 items that I'd like to quickly address. Pauline, there was a question about how does this work relate to the age-friendly efforts that AARP is doing. And I know you can speak to the kind of your beginning thinking about how did we start this process. And once you've answered that question, I'd love to do a quick round robin about what's the first thing people need to do if they're sitting at home, like they haven't started, what is the first thing they could do to be successful to have a local MPA in their area? So Pauline, if you could speak to the age friendly, and then we'll quickly pivot into that success question.
Yeah. I'm very familiar with the Age Friendly Initiative, been working on that since about 2010, and there is a lot of overlap with this work. What I understand is that the multi-sector plans for aging are a little bit broader. The Age Friendly Initiative has the 8 domains that they focus specifically on, and in our MPA efforts, we really tried to be more expansive of gathering needs from the community and engaging underserved communities, particularly, really making sure that we hear from groups that traditionally haven't had a voice at the table. And so, as I mentioned, a lot of overlap and lots to learn from the MPA and the Age Friendly Initiative efforts nationally.
Wonderful. Thank you so much. So with that, Carolyn, what's the one thing people need to do to be successful?
Be patient with the process. Contact your Center for Independent Living, your area agency on aging. Any phone call, any contact is better than no contact to get you started. Sometimes they just don't know you're there or what you're interested in doing. But once you take that first step, they will get you connected, and it just flies from there.
Wonderful. And Carmen?
Yeah, other than read the toolkit, right? Because now you all have access to the toolkit. I would just say, start meetings, start having the discussions, schedule time to just talk about why you want to create a plan or where you can start. So just, start meetings, start the conversations. And then through that, you're going to do some researching on resources available, and you're going to be able to connect with organizations that have that same common goal.
Thank you so much. Thank you to the California Collaborative for Long-Term Services and Supports. Thank you to Maria Kalina, who is the executive director of that organization. Thank you, Amanda, Pauline, Laura, especially the National Rural Health Association for co-hosting this event. Thank you to UC Davis for all of your support to bring people in for this discussion. Carolyn and Carmen, as always, thank you for your lived experience. Thank you for the work you're doing at the local level and serving as a wonderful inspiration to so many other communities. We hope you have a wonderful day and a safe and restful holiday season. And with that, we'll talk to you soon, and check out the Rural Toolkit. Please do.